Hi, I'm Liz from RFDS Queensland section, and I'm going to demonstrate how to reconstitute fibrinogen concentrate, or Fib Conc. So you'll need to remove your drugs from the life box, which is your Fib Conc, and also your bag of consumables. In here you've got water for injection, a transfer spike, a dispensing pin, and a filter. And there's one of each of these for each vial of the Fib Conc. You'll need a 50 ml syringe per vial and also alcohol wipes. Remove the Fib Conc from its sleeve and check its expiry date and of the water for injection. Remove the cap from the Fib Conc and wipe it clean with an alcohol wipe. Allow that to dry. Then take your transfer spike. It doesn't matter which end of the transfer spike goes into which vial. Remove the cover and then firmly place it at 90 degrees, it's directly above the bung. It is quite stiff. Remove the green cap. With the water for injection, remove the cap. Use a clean alcohol wipe. When that's dry, you have to line it up quite carefully. It's hard to do, so you might want to stabilise it. And then really firmly and quite determinedly pierce the water for injection so it makes a connection and forms a transfer. Like that. It runs in to the vial and swirl to mix it. Agitation will help, but do not shake it because it will foam up and it takes a really long time for that foam to dissipate. You probably want to do all three of your vials in sequence to allow them to run through whilst you can be busy doing other things. The Fib Conc will reconstitute better if it's at room temperature when you come to use it, but we appreciate that isn't always possible. Once that has run through, you can remove the water for injection and the spike from the bung, dispose of that as a sharp, and gently swirl it to mix. You can probably have one of these in each hand and rotate between which ones you're doing it when. But again, we do not shake them. And it takes between 10 to 15 minutes for this to disperse. So you can just leave that to reconstitute by itself and swirl intermittently as and when time allows. You don't have to stand and swirl it for a full 10 to 15 minutes. It will disperse a bit quicker if you do swirl it because you're obviously agitating it. But if you haven't got time or you're busy doing other things, then it's perfectly fine just to leave it on one bench top and let it do its own thing. You will see sometimes that there are quite large particles in this as it disperses, so just keep an eye on that to make sure that they are dispersing and do dissolve into solution. Some big bits might require a bit more of a firm agitation, but they should disperse over time. Once it's reconstituted, it should be clear and colourless, possibly opalescent, but not cloudy and to have no particles in it. You can see there is a bit of a residual foam there, but that should still be okay to administer. You'll then need to take the dispensing pin and pierce the stopper with it again. And then take your 50 ml syringe and the syringe filter. Attach the syringe to the filter and then take off the blue cap of the dispensing pin and attach the filter to the pin like that. So to withdraw the solution from the vial, obviously invert it and then slowly pull the plunger out the syringe. It does self-equalise, so there's no need to worry about a venting needle, but if you go nice and slow, you're less likely to make bubbles, which causes less of a problem when it comes to administration and less wastage. If you just withdraw it nice and slowly. down to a final volume of 50 mils. Should be the contents of the vial. You will get some bubbles and possibly foam, in which case obviously remove it like you would do normally and expel any air before removing, labelling and administering to the patient.